As an individual invested in improving population health outcomes in your community, you're probably used to thinking about and addressing the shared underlying factors that influence both mental health issues and substance use and addictions. You know that most of these issues are often associated with each other, and as a result, effective prevention and treatment considers how these health issues coexist and interact. But what about gambling? Have you ever thought about how gambling intersects with mental health issues and substance use and addiction, and what that might mean to how you develop your approach to prevention and treatment? The gambling environment is quickly changing, and you might be surprised at how many different avenues exist for people to gamble and become introduced to the harms from gambling. What's more, gambling is more closely linked with mental health issues and substance use than you might realize. Many of the same factors that make certain people more likely to experience issues with mental health and substance use and addiction can also influence their risk of experiencing the harms from gambling. For example, people that drink alcohol or smoke tobacco frequently are more than twice as likely to gamble frequently. Gambling harms are associated with higher rates of depression and other mental health issues. For example, approximately 32% of people who classify as problem gamblers report major depression compared to a national average of roughly 5%. Individuals with lower socioeconomic status spend proportionately more of their total income on gambling and are at a greater risk of experiencing gambling harms. People who classified as problem gamblers are almost 3 times more likely to be obese and are over 3 times more likely to watch 20 or more hours of television per week. Cannabis users are almost 2.5 times more likely to gamble. Additionally, research has found that students in grades 7 through 12 who classified as problem gamblers are 11 times more likely to report cannabis dependence than students without problem gambling behavior. And it's not just problem gambling. The majority of the negative consequences from gambling are experienced by people who classify as low-risk or moderate-risk gamblers. Gambling is a growing public health concern with diverse impacts on individual and community health and well-being. Expanding our lens to address gambling harms from a public health perspective could produce meaningful changes that reduce health inequity and improve quality of life. Let's change our perspective and try to consider gambling harm within a broader context. Want to learn more? We can help.